Good day to the viewing and the listening public. This is the COVID-19 update for Wednesday, April 28, 2021. I am Godfrey Brooms, and with me is the Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, it's always a pleasure having you here. Starting today, Minister, what is the number of persons that received the first shot of the COVID vaccine and the number of persons fully immunized?
Well, as of yesterday, we had 128,740 persons who received their first dose of the vaccine across Guyana. We also had 2,941 persons who received their second dose, so they can be considered to be fully immunized. So I think we're making good progress because this represents about a quarter of our adult population, a little bit more than a quarter of our adult population.
Minister, has the daily vaccination number increased?
We do on average about 5,000 to 6,000 a day. Some days are better than others, and we have noticed that on the weekends we don't get as much turnout as we would have expected. Nevertheless, we continue to work, we continue to keep centers open, and we continue to advocate for persons to come out and get their vaccines.
And also, Minister, is there any new COVID hotspot?
The hotspots that we're looking at right now are pretty much the same ones that we spoke about. In Region 4, where we have the most cases, we have seen that around Diamond, Eccles area, we have had a number of cases there, and those cases pretty much remain very high. On the East Coast, we have seen cases around Mount Repose, Lusignan, within that area. And in Georgetown, we have cases in Kitty and in Lodge and some other areas in Georgetown. So this is for Region 4. These are the main areas, the hotspots, if you like. But as I said before, in every village across Region 4, we can find one or two cases in different villages. In Region 3, we continue to see an increase in cases around that Tushin area. And again, almost every village in Region 3, we have cases. So for these two regions, we have seen these hotspots emerging, and we are closely monitoring them.
Thank you, Minister. Minister, would the COVID-19 vaccines have any adverse effect on people such as sport persons involved in high-intensity training, whether making them weak or unable to train?
Well, I'm not. First of all, these vaccines, how they work. One, when you get the vaccine, your immune system would be stimulated to produce antibodies to fight off a virus. So the vaccines does not interfere with any other body functions or other systems in the human body. What it does is just to stimulate your immune response to viruses and to protect you. So if you're an athlete, it wouldn't have any adverse effect on your performance as an athlete, and therefore there's no reason why high performance, or all athletes for that matter, there's no reason why they shouldn't take the vaccine.
Minister, would sport events be permitted if the sport persons are fully vaccinated?
We would consider it when we see that we have high amounts of vaccination, but right now you still have a lot of people that would need to get a vaccine. Once we are able to achieve herd immunity, then a number of things we would be able to open up, not just sports, but a number of other events we'll be able to open up. And that is something that we have to encourage people if we want to open up this society fully. then we have to work to get to herd immunity. As I said, for us to achieve herd immunity, we are looking at immunizing close to 500,000 Guyanese, adult Guyanese, and therefore, while we have come a far way, there's still a long way to go. And we can only achieve that if we encourage each other to come out and get the vaccine.
Thank you, Minister. Dr. Anthony, has the new vaccination legislation been approved by Cabinet, and how soon could we see it being presented in the National Assembly?
We have had a discussion on the legislation, but we believe that we don't need the legislation at this point in time. With the current legal framework that we have on the books already, we can proceed with vaccination, and that's what we are doing. So there's no need for any additional legislation at this point in time.
Thanks, Minister. Minister, I know you and the government as a whole has been encouraging persons to wear masks in public, and also the police now, well, a while now, they have been enforcing this here. But persons are continuing to flout this guidance that will not only protect themselves but others around them. What more can the government do or tell the population to stop the transmission of the disease?
Well, we have to educate, and I suppose by doing that, eventually the message would get across to people. We have consistently been repeating these messages because we know that it works. If you wear your mask properly, you are going to prevent the virus from spreading. You are going to prevent exposure to the virus. But if you're not wearing the mask properly, because we have noticed that there are lots of people who would have a mask in their possession. Some people have it in their pockets, others have it below their chin, exposing their nose and their mouth. If you do that, then you are not preventing transmission. You prevent transmission by using these masks to create a physical barrier between yourself and the virus. And that's how you prevent transmission. So you're going to prevent the virus from entering your body. And the most common ways in which the virus enters your body would be through your nose or your mouth. And if you don't wear your mask consistently and you are in crowded areas, then you're putting yourself at risk of getting the virus. And that's what some people have been doing. And unfortunately, when they do that, they are going to get the virus, they are going to get sick. And a percentage of them are going to end up in the hospital, and a percentage of those probably will die. And it's a serious thing, but I guess we have to constantly remind people of the seriousness of this disease.
Thank you, Minister. And if I can go off on a tangent, 2 years ago, after the launch of the malaria vaccine pilot program, more than 1.7 million doses of the vaccine have been administered across Ghana, Kenya, and Malawi. What does this mean for Guyana and the fight against malaria?
Well, I mean, we always welcome new innovations and new tools that are going to help us to reduce the prevalence of malaria. In Guyana, we have a fairly high prevalence of malaria, especially in regions 1, 7, 8, and 9. Those regions account for about 94% of our cases. So if there's a new method, a new technology that can assist us with reducing the prevalence of malaria, then certainly it's something worth looking at. The vaccine that was out some time ago, but used primarily in West Africa, has had initially an efficacy of about 56%. But having run that vaccine over a 4-year trial, that particular vaccine, they saw that over 4 years, the efficacy was reduced to 36%. There's, however, new promise because there's a new vaccine that has been recently tested. And with that new vaccine, which is called, I think, R21, that particular vaccine shows a lot of promise. And as you know, that vaccines would normally go through clinical trials. So it has gone through a phase 1 clinical trial and a phase 2 clinical trial. And they are now preparing to do a phase 3 clinical trial. The phase 2 clinical trial has shown very optimistic results because it shows that the vaccine is between maybe 70 to 75% efficacious. And that is a good thing. However, when they did the phase 2 trials, they did it with a limited amount of persons. And this was done really with babies. So while the results have been good, you now have to move to the phase 3 trial to see whether or not the results would remain as high as they found in the phase 2 trial. And then ultimately they're going to test it in real life scenario. So we still have a couple of years before those vaccines, if it remain at that high efficacy, would become available to us. But of course, we are constantly on the lookout, as I said, for new innovations to see how they work and if they work well, to bring them to Guyana so that we can help to solve the health problems that we have here. In this specific instance, we want to deal with malaria.
Thank you very much, Minister.
Thank you.
This has been the COVID-19 update with the Minister of Health, the Honorable Dr. Frank Anthony. For more information, you can visit our website at dpi.gov.gy and our social media platforms. Godfrey Brooms is saying goodbye for now.